America's health is a problem.
It's just whack, whack, whack. This whole thing is just whack. Whack, this whole situation is ridiculously whack. Health from this whack food with this whack mood. Whack cause we don't move, it's whack, it's just so whack, it's just whack, whack, whack. This whole thing is just whack, whack. This whole situation is ridiculously whack. Health from this whack food with this whack mood. Whack cause we don't move, it's whack, it's just so whack, so whack. This is whack, so you take the chips and soda off the rack, put it right back. Cause obesity will sneak up on you and it's like in the 1980s, cracking black, push an entire community back. That was whack, but in 2020, same story, Jack. Except it's high fructose corn syrup, that's basically sugar crack. Minority communities running rampant with the Big Mac, or a box with jumping jack, or a king who makes it your way like he's got your back. Listen to this, then turn around, stab you in the back. BMI so I can't see the back. Arteries a clog with a nasty plaque. Get ready for a heart attack. Can't even believe that they put the blame on them because they can't make it around the track and not on the multiple resources that they lack. We're talking social determinants of health to be exact. Cause lack of access to care is common for brown and black, and health disparities are quite the setback. We already know that this is so whack, whack, whack. This whole thing is just whack, whack. This whole situation is ridiculously whack. Health from this whack food, but this whack mood. Whack cause we don't move, it's whack, it's just so whack, so whack, 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 whack. This whole thing is just whack, whack. This whole situation is ridiculously whack. Health from this whack food, but this whack mood. Whack cause we don't move, it's whack, it's just so whack, so whack. No, I'm not taking what I said back. CDC got all the statistics, Paso how we got stacks on stacks. Now they're falling off the rack, and every single year they will increase until we act. Cause this is so whack. No, I'm not smoking crack, throwing that liquor back. Cause I don't do that, all I speak is real facts. 1977, McGovern tried to get us off this track, but all the food industries, the dairy, the meat, the salt, the sugar, the red pack, came out the board with the all clap back, decided that they were not having that. Like big tobacco when it got snacked with evidence that six were cancer's favorite snack. Disregarded the facts, didn't listen to Simo Wise. When you said your hands are dirty, you should wash that. Seems like it's about profit, and your life don't mean jack. Unless I got the whole thing where it's back. My hand can't get to faces fast enough to smack. I'm so over the effectiveness we lack. With hospitals selling every type of snack, kids TV advertising crap, does it glow in the dark create dental plaque? Can you even grow mold on that? Red dye 40 listed on the back of the pack. Nah, I wouldn't need that. Whack, whack, whack. This whole thing is just whack, whack. This whole situation is ridiculously whack. Health from this whack food, but this whack mood. Whack cause we don't move, it's whack, it's just so whack, so whack. Whack, whack, whack. This whole thing is just whack, whack. This whole situation is ridiculously whack. Health from this whack food, but this whack mood. Whack cause we don't move, it's whack, it's just so whack, so whack. This game needs a new quarterback, whole new plan of attack. I won't sit back, watch lives fall right through the cracks. And if that means I catch some flack, cause I think lifestyles are way back. If you push lifestyle, then you're a quack. Hold up. Research got my back, there's evidence, can you handle that? We need the basics back, it's as simple as that. Cause this is whack, 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 this is whack.
How we doing? Is this me to say a few things, sorry, right now?
Yes.
All right. Well, thanks everybody for joining us. I'm just going to introduce this session and let our students and Dr. Marsha Gale Davis, sorry, and Andrea take over. I hope you heard that song and some of those lyrics. I hope you heard. I'm not taking this back. I hope you heard we need a new quarterback. I hope you heard we need the basics back. These are different basics. And I hope you heard in the last session, Dr. Joe Davis talking about the dual pandemics of COVID and racism. And right in the middle of that are these gigantic pandemics around health disparities that are in the middle of our work in schools and communities. And that's what we're here to talk to you about. We're here to talk to you about and let our students talk about, and Dr. Marcia Gale talk about, our students taking the lead in their schools, communities, and families around these kinds of disparities that look invisible to most of us, around the 6 measures of the American College of Lifestyle Medicine, which include sleep and exercise and eating well, moving to a plant-based diet, and mitigating stress and avoiding harmful substances and having healthy relationships. And we've been working on this as a website, as an app, and social media, thanks to Isari, who you see there, and others, and Andrea, and Dr. Marcia Gale getting the songs out, and our students who are now putting out tons of stuff. So I'm going to hand it over. We've been trying to change our personal qualities. We made a guidebook for teachers and advisors using the 6 ACLM measures, using learning plans, advisories, projects students are doing to change their lives, their schools, their communities. So I'll hand it over and let's have a great session.
Awesome. Thank you so much, Elliot. Before we introduce Dr. D, I just wanted to invite everyone to please share a thought, a word, what came to mind, how you felt while listening to Dr. D's song, Whack. I will be dropping our handles in the chat. Otherwise, Dr. D, please take it away.
Excellent. Thank you so much, Elliot. Thank you, Isari. Thank you, Andrea, our leaders for this project, along with our amazing students here. So just for those who don't know me well, my name is Dr. Marcia Gale Davis, and I'm a primary care internist and a preventionist. You're probably wondering what that even means. So I'll give you a little bit of explanation on that. So a primary care internist is a physician who takes care of adult patients as their primary doctor in the clinic. Not in the hospital, because you have another type of doctor called a hospitalist, who's typically the one who takes care of patients in the hospital. So your typical primary care doctor that takes care of adults, that's an internist. And I'm also a preventionist. Now, what is that? A lot of you might not be familiar with that term, but you have a lot of "ist" in medicine. You have cardiologists, you have immunologists, you have gastroenterologists, you have all these. And so a preventionist is a physician who works at the intersection of clinical medicine and prevention, public health. Really, it's kind of combining those two with the goal of promoting health and preventing disease. And also as a preventionist, you're really focused on populations of people, groups of people. You're looking at a larger group of individuals and trying to treat the health of a population versus just individual patients. So I have loved this career path for myself because it's 2 different focuses. It's being able to deal with the population and it's being able to deal with the individual, which I think is the best of both worlds. I'm also a member of the American College of Lifestyle Medicine. And in that organization, I lead an initiative called the HEAL Initiative, which stands for Health Equity Achieved through Lifestyle Medicine. So I'll talk a little bit more about that later. But I'm just so privileged to be a part of the work that we are doing to change lives, because that's really what it boils down to. This work is really critical, and it's really the ability to put students on the capacity that you have as an organization to put students on a path to success, not only in their education, but in their health as well, because health is really crucial to being able to pursue your education. And not only that, but more importantly, as BPL says, to allow students to live lives of their own design. And you won't be able to do that if health is something that you don't have. So that's why it's really important. BPL as well is already a beacon of positive change in the education space. And this initiative that we've been working on, Big Picture Living, is an incredible opportunity and really a mission to expand the impact that BPL has on students in an even more of a feasible way as it pertains to being able to create an environment around them that's going to allow them to live lives of their own design. You may not be aware of this, but Big Picture Living is actually one of the most creative, innovative, community-oriented public health efforts that are happening right now. And public health is something that we have seen during this pandemic that is so incredibly important. Public health, unfortunately, is something we haven't invested enough in our US healthcare system. And we're learning what happens when we don't invest in public health and how important it is not only to be able to provide a system that can treat diseases, but to create a system that can prevent diseases as well. And what we're doing here with Big Picture Living is we're actually creating a culture of health. That's what this project is about. It's creating a microculture of health that can actually wrap around students and insulate them, protect students from a larger outside environment that's promoting health in a different direction. And quite frankly, a direction that students don't want to find themselves in 20, 30 years, 40 years down the road. And as a school organization, we have the opportunity and the ability to actually change our life trajectory for our students. So a couple of things I want to mention, really looking at the statistics. The current statistics project that about 60 to 80% of adults in the US in 2050 will have obesity. What is 80%? Well, what does 80% of a cup look like? Majority of it's full. What's 80% of a pizza eaten? Most of it's gone. That's majority of our population that will have a disease process going on. And the health risks associated with obesity are not only well documented in the medical literature, but they're also real. And these statistics are actual stories. They are the 40-year-old dad or the 40-year-old mom that dies of a heart attack, leaving her children and his children parentless. It's the 50-year-old brother or sister that suffers from a stroke and is left completely disabled and unable to care for themselves. It's the 60-year-old aunt or uncle that suffers from end-stage renal disease, which is what we know as kidney disease, or when your kidneys fail and they have to have a limb amputated or they have to be on dialysis. We've seen those kind of stories. We know those kind of people because they're in our own families. And so WAC is a modern day public service announcement delivered in the art form of hip hop, which is the #1 most popular genre right now as of 2017 per Nielsen. According to that statistic that they provided around genres, and it's one of the most powerful art forms to ever be created. The kind of impact that hip hop has on our world currently is so far reaching. Pretty much all music styles have that kind of underpinning at this point. And the other question is, what is a public service announcement? It's a short community-oriented message that is meant to raise awareness about an important issue in the interest of the public. And it also is shared at no cost with no intention of profit. And so with that, it's a labor of love for me. This is art that was a labor of love, a passion project that was really birthed from deep frustrations around the reality of what I was seeing as a medical student and as a resident in the healthcare system. And it's the fact that we have a very interesting healthcare system. We have a very contradictory healthcare system where the system in the name describes caring for health, but in our actions actually doesn't do that. And so we're left with a landscape and a climate of health status in this country that is not aligning with the type of resources that we have as a nation. We spend the most on healthcare, and out of all of our peers, we have the worst in terms of life expectancy. And it's not just a minor reduction. We're kind of like the one at the bottom and all the other countries are at the top. They're in a group, we're by ourselves at the bottom. That doesn't make sense. The US having that level of health status amongst the population does not make sense with the type of resources that we have. And how do we see this kind of implicated in the population? We see that with health disparities. where the level of disease is so significantly different in one population of people versus another, where, for example, in Milwaukee, you might have a difference of life expectancy that's around 20 years in neighborhoods that are juxtaposition, literally beside each other. That's really significant. And so that's the kind of work that I do. I work at the intersection of primary care, prevention, and health equity. And when I mention clinical medicine or primary care, I'm really speaking to the full practice of clinical medicine, which includes lifestyle medicine. And with prevention, I'm thinking of how clinical medicine and public health come together. And then health equity, of course, is a fundamental component of an optimally functioning healthcare system. So I lead the HEAL initiative. I described that to you in the name, Health Equity Achieved Through Lifestyle Medicine. And it's an effort to advance and achieve health equity through lifestyle medicine, working through this framework of community engaged lifestyle medicine. And Big Picture Living is an example of community engaged lifestyle medicine, because we are engaging in the 6 measures, which that's the term that we're using for the students, but in general, how we use it in our practice, the 6 pillars of health, meaning that if you employ these 6 things, good nutrition, the kind of essentially giving your body what it needs to really be active on the highest level, physical activity, which is not just exercise, but being active, moving and not being sedentary, sleeping well, managing stress in a healthful way, having positive social connections, and also not taking in anything that's actually going to damage your body. If you adhere to these 6 principles, your likelihood of living a very high quality of life is very high. And so we want to implement these habits in our students at a young age so that they don't have to worry about the things that I see when I see patients in the clinic. They don't have to deal with the complications of chronic diseases that we know are up to 80% preventable. It's an absolute shame that people are dying needlessly from diseases that they don't need to have. And we already saw the impact of individuals dying needlessly this past year with COVID, because our efforts weren't organized well enough. We have 600,000 lives that were unnecessarily lost. And maybe we couldn't save everybody, but we should not have 600,000 people who are not with us anymore. And so I just want to communicate just how important this work is that we're doing, and your involvement in it is making an incredible difference that is going to last our students for years to come. So thank you for the opportunity to share this work. And of course, if you have any questions, I'll be available.
Awesome. Thank you so much, Dr. D. We really appreciate you being here, helping support us and this new initiative that we've been launching. Up next, part of the initiative, or there's a lot of parts to the initiative, one of them being student-led work. So I will actually be passing the mic to 2 of our students that are here today, Maria Esparza and Alicia Daga, and they will be leading us introducing what Big Picture Living Skunkworks is, as well as some of the projects that the students have created in this new initiative.
Hi, as Isari said, I am Maria Esparza. The Skunkworks, we're a group of kids from around the state/world that come together and we come up with a lot of ideas. One thing we did recently was the letter to Dr. Fauci. We thought this was something we had to do since we saw that he talked a lot about how to treat it once it happened, but we want to touch on how we could prevent from actually happening by boosting the immune system using our 6 measures. And sorry, you can go ahead and play the letter.
Dear Dr. Fauci, thank you for all your work fighting COVID-19 and on issues surrounding public health. You have been a driving force in turning the tide in this pandemic.
We are a group of students from Big Picture learning schools around the world who, for the past year, have been working with the American College of Lifestyle Medicine to make changes in our lives, schools, and communities around the 6 measures that can prevent chronic health conditions.
The measures include eating a more plant-based diet, increasing exercise, getting enough sleep, nurturing healthy relationships, avoiding harmful substances, and mitigating stress. We want to move our healthcare system to be one focus, not just on interventions, but on prevention.
Change only happens when we work together. Over the past year, we've embraced and integrated each ACLM measure into our growing school communities and encouraged hundreds of students and teachers to do the same through a month-long social media challenge. Through the hashtag BPLiving challenge, we found that social media is a great way to communicate with people and encourage bright minds around the world globally.
And watching a press conference, we noticed you discussing pre-existing conditions such as obesity and type 2 diabetes as reasons for high instances of catching COVID-19 and dying. Yet you don't mention that many of these conditions can be prevented and managed through healthy lifestyle choices. For example, those with obesity, type 2 diabetes, lung diseases, and serious heart conditions are prone to contracting COVID-19.
We understand the importance of vaccines as both prevention and intervention strategies, but we are requesting that you also encourage the public to consider implementing the ACLM 6 pillars as a research and tested solution to reduce the risk of getting COVID-19.
In the fight against COVID-19 and in the course of our lives, we want to see all types of diseases managed as much as possible by lifestyle changes, especially for disproportionately impacted communities of color. Over the past year, as students and as an international school community, we worked to make these changes. We found that with community support, anything is possible. Let's be that community.
As teenagers, we can be more mature than what people usually think and come up with ideas to improve everyone's lives. We care about the world and what happens to it. Although we want to bring to light the problems that teenagers are facing now, we aim for a solution that will benefit the entire community, and we want to create a reality where we, as teenagers, are empowered to take care of our own health.
We know with proactive steps we take now towards healthy living, we will be physically and mentally prepared for the next global crisis. Instead of simply reacting to the situation, we aim to be leaders orchestrating the change.
Dr. Fauci, please join us on this mission to improve our communities through lifestyle changes. It starts with one decision. Swap whole grains for meat and processed foods. Take a daily walk. Practice meditation. Thank your neighbor. And nurture relationships and strengthen your soul. Decide to live healthy. To live for each other. To be the next change maker in the fight for our health. Thank you for your time and consideration. We are standing by to join you in the fight for our health. Sincerely, the Skunkworks team.
So hello everyone, I'm Alicia and I am currently in Mumbai, India, and along with Maria, Tirza who's here, Izari and Andrea, and many other students who join us from around the world, we formed the Skunkworks team, and we essentially we started, the Skunkworks team has been around for a while now, and we've worked on multiple projects. One of our biggest projects has been the BPLiving challenge, which was a huge social media movement that we started, where we encouraged schools to post about how they were interacting with each of the measures, and for a week's time, and at the end of the 6 weeks, we calculated the winner and gave them a prize for I think $1,000. So this really helped reach out to many people and connect more schools and students to the Big Picture Living project. Other than this, we've worked on deciding like the name for the measures, or any changes we wanted to bring to the site. And we also do like DIY challenges cooking challenges where we come together, we cook together on Zoom. So I think we've taken the pandemic, which has been like a difficult situation, and we've made the most we can out of it, because I doubt we'd be cooking together like this especially from across the world, if it weren't for the connectivity becoming so much stronger. And so we've also had some DIY challenges we made, like relaxing galaxy jars or origami art, and all of this can be found on our social media and on the website. Even the illustrations you see over here that are sort of the navigators on the website were made by a Skunkworks team member. So essentially, we try to brainstorm on ideas and see how we can better the project, how we can reach more people. We look at the app, we give feedback for that, and we hope that as students we can make as big of an impact with this project.
Awesome. Thank you so much, Alicia and Maria, for diving deeper into the Big Picture Living Skunkworks. You know, the role that you guys, important role that you guys have all been playing in this initiative, implementing the 6 measures backed up by ACLM, which is American College of Lifestyle Medicine's research. And now we'll also, we'll pass it on to my colleague, Andrea from FableVision, who's been helping us run the initiative as well.
Hi, everyone. So I know a couple of you might have remembered me from last year's Big Bang, where we were talking about this crazy idea of what I think then we were calling it the Healthy Living app or Healthy Living program. And over the course of this year, working with the students in Isari, we have developed out the website. So I'm going to share the website and sort of talk a little bit how, as advisors, how the website can get used. So when you go to the Big Picture Living's page, and again, everything on this page has been co-developed on the site, has been co-developed with students, which personally, so my background's in journalism, working at newspapers and running newspapers, I find the best stories and the best vision come from our youth. And it is exciting for me personally to have been working very closely with these teenagers to develop out something that's going to change the world. And it's exciting to see that. So when you go onto the site, you'll see there are different areas you can go to, 6 measures where you can dive deeper into the 6 pillars. What are the 6 pillars with some ACLM resources? The podcasts are where you can listen to podcasts created by our students at Big Picture. And we're adding to these as they come along. The Conscious Cabbage might be one of my favorite ones for completely selfish reasons. I find it adorable and fantastic. And then, as Isari pointed out, the Student Showcase is where these are vetted projects that students and advisors have shared with Isari and I to put onto the website, and where students are taking what they're learning about the 6 measures and how they're applying it to their life. So these are examples of how they're applying it into their lives and into their, into their education part of everything. A lot of creativity is going into this. Little sneak, Tirza is not on here, but when she was on here earlier, Tirza is one of our animators. And I can tell you, she has a series coming up soon on the 6 measures. And it's simply fantastic. And I may voice one of the characters, and I just think it's awesome. And I think you guys are going to absolutely love it. Coming from FableVision, which is a media studio in Boston, just watching what these students are creating. I mean, I shared it. I shared the Tears' animation with my husband, and he's like, "Oh, so one of the artists at the studio did that." I said, "No, an amazing Big Picture student did this." Because that is what I love about this program. These are amazing Big Picture students coming out and creating their projects. So with all that said, over here with the advisory resources, as Isari and I have been working with students on how to, do the 6 measures, we realized, we have to make sure that the advisors are also knowing how to do the 6 measures. So as Elliot mentioned, we have a Big Picture Living Teacher Advisor Guide. Just sort of gives an overview of what this is and how handy dandy you can use this. There are QR codes in here, so you don't have to memorize each section of the page. You can just take out your phone and click on it, and it will go all the way over to the page that is applied to. So it goes into internships, it goes into Who Am I projects, personal learning plans. Follow us on social media, visit the site. So this is all on the advisory resource page here. And it continues, hold on, I skipped ahead. And it continues going into, how do you share your student projects to be put on the site? How do you share the projects with social media? If you are not following Big Picture Living on social media, follow Big Picture Living on social media. Each one of them does something slightly different. I know I kind of live in Instagram, and I'll tell you, the days that I get to sit there and go, hey, I'm going to go watch one of the videos of the students interviewing Dr. Marsha Gale Davis. It is amazing to hear and to see the students. I'm sorry, I'm very excited about stuff, but to see and hear these students asking the questions and getting these answers, and they're answers that apply to our daily lives. It's not just a canned answer, which is what I love about working with Dr. Marsha Gale. She speaks to the student. She's not just reading from a textbook. She speaks to the student, and she is amazing. And I'm not just saying that because she is on the call. I absolutely adore her. So this is the advisory guide. And then we also have, and this is something that our advisors and teachers have asked for, is our social media challenge calendar coming up for next year. So you guys can see what we have planned for social media and how you can get involved in it. We have it broken out month by month, week by week. So you can see what we're encouraging our students to do and ways that you can implement it into into what you're doing with your students. And I know I probably talked way too much, but that is there. We have ideas to get started, and little handy dandy notebooky things that you can download and start putting into your notebooks. And I encourage you guys, if you haven't already, explore the site and see what your students have been creating. And if your students are creating projects that you say, hey, this needs to be on the site, shoot us an email and we'll make sure that it gets on the site and shared on out. So yeah, so I get very excited.
Awesome. Thank you so much, Andrea. I really think these resources, the social media calendar, advisory guide, it's a well put together packet that'll hopefully help this initiative go to the next level this upcoming year. And yeah, we'd love to dive deeper into some of the ideas that once again is student led. Our students, all of our skunkworks are working personally with their schools, they're one-on-one with their advisors in planning for this new year for the fall. So we have clubs, podcasts, lots of great things coming up. So what we're going to do next is we're going to go into 2 breakout rooms led by Maria and Alicia, and they're going to dive a little bit deeper in the exciting projects and news that's coming up. Hi, everyone. Welcome back. Give it a couple minutes. Awesome. Well, we hope everyone felt inspired, got to know more a little bit, got to dive deeper into at least a couple of the 6 measures. For this next part, we'd love to open up the space for any questions around the 6 measures or healthy lifestyle, or even ways that you can implement the Big Picture Living initiative into your school. So we'll have a Q&A with Dr. Marsha Gale Davis. Yeah, so if you have any questions, please do drop them in the chat, or you can also share them on social media and tag us, and we can respond this way.
And all questions are good questions. I'm a firm believer in that feeling of I don't want to ask this question in a room of other people. Just put that to the side and see what you feel, because that's the only way that we're gonna be able to talk about what's gonna get our students to be able to live the best life that they can. And I'm looking forward to hear from you.
I had a question for you, Dr. Mashagil. So I wanted to know that, a lot of times when we talk about, especially with the Big Bang this year being about like expectations revolution, sometimes you have something like, for example, an exam or something or a week where you're really busy and you really need to overwork yourself, right? Because that's an expectation you set for yourself. But in the process you compromise on sleep, right? So I wanted to ask you if it's worth it, because sometimes, a lot of people say sometimes you gotta work 1 week really really hard to get something done, but at the same time you can't just do everything, you have to compromise on something. And sometimes that's our sleep, so, or our time to rest or chill. So I was wondering how you suggest we cope with that.
That's an excellent question, Alicia, and a question that not only you have, but adults have as well. How to manage life is your question when you're trying to do your best. And I think a part of that is understanding that we're not perfect and we don't live in a perfect world. So not every situation is going to be the ideal as you think about it. Sometimes it doesn't go well. Sometimes you had a week that was really hard and you didn't do any of the things you wanted to do, or you didn't reach any of the goals that you wanted to reach. And sometimes you have projects that you need to get done, and the only way you can see yourself getting it done is to cut your sleep to get enough time to actually complete it. So those things happen. I think the most important thing to think about is the kind of pattern that you're creating for yourself. If this is kind of a one-time thing, an isolated event, in the grand scheme of things, it's not going to have that significant of an impact. But if it becomes a pattern where chronically, repeatedly, consistently, you're not being able to sleep well, or you're not getting enough sleep, at the end of the day, that will have a toll on your health. So as much as you want to do these things that you're interested in doing and you have these goals that you want to reach, if when you reach the goal, you're not in the best of health to enjoy that accomplishment, that doesn't really make sense. So what actually makes sense for your life? What makes sense is that you want to be able to live in a way that you can be your best self, you can live your fullest life, you can experience the things that you want to experience, to the full. And health is such a big part of you being able to do that, that it is really important that you invest in your health in that way. So my thing is, I've had those moments too. I've had moments where I've had to cut sleep to get something done. But I think about, okay, was there something I could have done to better my time management so I didn't have to do that? And then how do I do better the next time? Or, okay, so this was this week, but let me move on to the next week and get myself back on track, so that majority of the time I'm living in a healthful way, versus these 1 or 2, 3 times that it's kind of like a drop of red dye in the ocean, not really negligible. But if you keep pouring dye every day in the ocean, at some point it's going to turn red. So I kind of think about making sure your overall pattern is really facilitating your health. I hope that was a good answer to your question.
I kind of want to piggyback off of what Alicia said about time. Like, I myself struggle with time management and to fit in my move, like, working out and everything. What are some like small workouts you think we can do, like in between things, since I know people are busy and I myself am busy as well? Like, what are some quick exercises we can do to get in at least a little bit of exercise every day?
That's a great question, Maria. So the thing about activity is that a lot of times our perception about things makes it really hard to actually implement them, because in our heads we're thinking, exercise, I gotta do P90X, I gotta run a marathon, I gotta do something really intense. And the reality of it is that, for example, walking is one of the best forms of exercise out there. It's actually, if you think about trying to get the biggest bang for your buck when it comes to physical activity, it's walking. But people want to do more fancy types of exercises, CrossFit and Taekwondo, and in the gym lifting weights and all these different things. And that's not necessarily necessary for your health. You can get so much from the standpoint of a health benefit from just walking. And as we know, the reality is that exercise is a medicine. So the more you do it, the more it impacts you in a positive way. What we know about the literature is that you don't have to do one kind of bout of exercise to get the benefit. You can actually break it up. So you're just asking me, how do you implement it in your day? You can actually break up your exercises. So the overall goal is to get about 30 minutes of exercise in for the 5 days of the week. That's really kind of the ideal for just the bare minimum of physical activity. So that could be about 7 minutes per exercise. 21 minutes, okay, you're close to the 30 mark. And if you're doing what we call vigorous physical activity, excuse me. If you're doing vigorous physical activity, then you're actually not needing to do as much. You could do about 15 minutes for 5 days out of the week. So there's actually a circuit called the 7-minute exercise or the 7-minute workout. If you Google it, if you look on YouTube, you can find it. That's a very easy set of exercises to do. It involves jumping jacks. It involves doing, what do they call those? It's like you're resting on an incline and you're kind of pushing your body up. I can't remember the name off the top of my head, but that's another part of the workout. But you have all these different exercises in the workout. And it's really effective because it's a part of what we call high intensity interval training, which is a very efficient form of exercise. And so you're getting a lot out of doing those movements in a short amount of time that can equal you doing exercise that's more, not as vigorous for longer periods of time. So my suggestion is that think about where you are more likely to do the exercise. For me, I am not somebody who's going to exercise in the afternoon. So if I miss that window in the morning, I miss the window to exercise. The likelihood of me exercising is very low. I know that about myself. So I make sure to exercise in the morning. So once I'm done with it, I don't have to worry about it. And then I think about, okay, well, if I didn't get a chance to do it, where can I fit something else in? Can I try to decrease my sedentary habits during the day? Can I try to walk towards the supermarket instead of parking up really close? Can I take the stairs instead of the elevator? Those are different ways that we can actually build activity in our day that have an impact over time, that are really important, because a part of our activity is not only being active, but also decreasing being sedentary. They're two different things if you hadn't thought about that, but they're actually two different things.
Christy, I saw your question in chat. I wanted to address it. I have shared, not directly to my schools, but in a kind of indirect way on BPL by making a survey, which I shared in my breakout room. And then after that, I did share a bit of what was the BPL initiative. And a lot of people thought it was interesting and did not know a lot about it, actually. And they were a little shocked about the facts of how sleep affects you, or if you don't do like a certain amount of hours of activity, what it can do in the long run. They were kind of mind blown on how serious it actually is, and they did not know.
And if you are interested in rolling out this type of program into your school, Isari dropped in her email. We can hook you up and we can talk with other schools, connect you with other schools that have done it and how to roll it out.
Yep. Awesome. Yay, thank you so much for joining us. As a closing off, once again, my email is in the chat, or if you want to reach out directly, we'd love to set up some time one-on-one, me and Andrew, to kind of talk through how we can help support you and your school with implementing these measures. And as a reflection or just thought question to leave you guys off with, what measure are you going to challenge yourself to work on today? Whether that's maybe moving more, having time to de-stress, maybe some social time. Let us know, share your story or personal journey on social media. We would love to be with you during this journey. And otherwise, we'll see you later this week Tomorrow we'll be leading a pick-me-up early in the morning at 8 a.m. Pacific Standard Time. And we will also be leading an after-hours activity where we will be making a healthy peanut butter and oat snack. So if you are interested, please do join us. And we'll see you guys there. Thank you so much.
Sorry, I'm so sorry. I just wanted to make one last comment. I hope that's fine. I know that all of this can sound very overwhelming. When you're trying to implement habits or change habits, it can feel very overwhelming. It can feel very tasking. Is this even possible? Can I do this? I want you to remember that everything starts with one step. And that's all you have to worry about, is just doing the first thing, which is to take the first step. That step should not be very large. It should be a small step so that you can take it. And then once you take that step, you'll be able to take further steps. So think about it in that way, that your perspective is, it's reasonable because you're going to do it one step at a time versus this huge goal I'm trying to reach. No one climbs Mount Everest jumping to the top. You take steps to get there. So just keep that in mind.
Looking forward to everybody joining us this year. Students, staff, let's get our schools in a place where our students can perform well and they're healthy.